in arrhythmology, we have seen over the last years that it has been a lot of innovations and a lot of improvements. We have been very lucky in different areas of the arrhythmology how the progress has allowed us to treat better our patients. So that's why it's very difficult to say one single area because arrhythmology covers a lot of areas. Let me just try to go on with different aspects. First of all, we can talk about genetic diseases. Over the last 30 years, we have improved a lot our knowledge, but certainly we have not advanced enough in terms of therapy, genetic therapy. So probably in the next years we will develop and we'll see a strong development of everything related to therapy and genetics. So we are still far from that, but the first steps are being put, especially in familial polymorphic catecholaminergic VT and other diseases. So we expect there to have a strong improvement in how we treat our patients. Secondly, if we look, for instance, in pacing, we are now looking how the leadless pacemaker is being implemented. This is the first step again, it's a small step, but important one, towards a fully automatic pacemaker, self-powered, that will not need leads to be implemented and that will interconnect with different areas of the heart via wireless connections and things like that. So probably the evolution of technology here will help us a lot. Also, in terms of atrial fibrillation, we'll probably see in the next years a strong advancement in everything related to how to better treat our patients. We are not treating them properly yet. We are having success rate around 70%, whatever we use, whatever technology we use. So probably this means that in the next years, a strong development of new technologies, new tools, new ways of doing the procedure, probably more related to the anatomy of the heart, will help us to better treat our patients and to go to further number of success in our patients. I don't want to miss one important thing, which is the fact that the patients will have to be participants of their health. We are changing. The health of the 21st century will change from a more paternalistic way of looking at medicine that we have seen until now towards a more participative way of looking at medicine. So the physicians, together with the patients, will have to interact and will have to decide, and the patient will have a lot of responsibility in his own health. So this is something that we will see. Finally, I would also like to make the importance of what is now calling the big data, the systems medicine, and how we have come from the anatomy to the cell, and now probably we are realizing that you have to go back to the patient, and that the patient is interacting, all the diseases are interacting with each other, and we will have to know and we'll have to understand how this happens and how modifying one part of one disease we are interacting with other diseases. And this is what is called the system medicine that certainly will be very important over the next year. So I think these are kind of the most important issues that I see in the next 10 to 15 years in medicine.